have my green
No.
card is ridiculous.
They can. It doesn't matter if you have it or not. So they're coming up with ways.
Exactly.
Once you get a felony, what's it called? A felony, they can deport you. Green card or no green card, they can deport you.
Even without a felony, they can deport you.
They can deport you.
So when I heard you guys speaking about, you keeping a head down and staying out of trouble, I kind of disagree based on the fact that he did nothing.
I just said it too. I LJ. I say, keeping out of trouble, though, I'm nothing to do with it. Same way, them still have got weed.
With the green card, you can something the if when with the deport, they can just deport you like that. You can go to court with it.
But once you get a felony, they can just against you. They can deport you.
They can cite it.
So in his case, they brought his green card to him and everything, and trying to prove his innocence. And they said because he was speeding, he's not a law-abiding citizen, and it's not a crime. He cannot be locked up for it. It's not a crime, but he's being called a unlawful citizen for going 15 miles an hour. Now, if you saw a American going down the road at 15 miles over the speed limit, all they would have gotten is a slap on the wrist and they'd leave. We're still legal. He had a driver's license from the state in which he was stopped. That proves that he's supposed to be there, but you still brought him into detention.
That's crazy.
But before them deport anybody, them always have to go through the courts.
But you have to understand. And
nobody's working.
If you look into it,
what do you mean
Americans?
No, what I mean in America now?
Well, it's Republican against the Democrats right now. So they shut down the government. Like
nobody now work.
Basically, the courts can't come to an agreement. So because they can't come to an agreement, they shut the entire government down until they can come to an agreement.
U.S. postal people, I think they're not getting paid. People who work for the government not getting paid. It's just
they can't. I think they can't decide on the budget that would fit everybody. So they're
working, but they're not getting paid.
Mm-hmm.
Shay, may I go come down just in case somebody want to come up here?
I'm about to come down as well.
Yeah.
They're working, but they're not getting no pay.
Sister, later.
Crazy. All right. Yes, sister. That's crazy, though.
It's like, what's going on though? It's basically they can't come to a deal. So like certain government-funded programs are not getting funding. For instance, even the EBT people and stuff like that, like food stamps, starting if you not finish it October, then November.
Please, somebody attack. I will not hear you. Wait till the man don't talk and then you talk. You just talk. I will not hear no what you say.
So even like the government-funded programs, they're not gonna get funding for next month because of the shutdown. So like even EBT, food stamps and stuff like that.
No food stamps.
So all who take food stamp now get none next month.
Nope.
None.
Until the government open back up.
Until they open up.
Me rascal, then someone now go suffer them, man.
So who will celebrate Thanksgiving? Get checked for Thanksgiving because there's no EBT.
So someone never live now, like the Batman them in America. How not survive? But you in America, how not survive now? Cause me see that it confirm no bitter purple.
What the shit, man?
Purple never come to me and brag upon me with him blood clad food stamp. Hello? I want to see him. Next week I see him. Where you say now, LG?
Me live America a while now. Live America like 8 or 9 years now. And from me come here, me at work, me can never get them always I say me make too much money, sir.
And you alone, even people over my life where is American citizen always say, oh, them get food stamp and them can't get. I'm sorry, go.
Yeah.
I got food stamp one time and I never got food stamp back again.
See, my letter says she never get LPA.
Never got it back again. Anytime I go shopping, I pay out of my pocket.
I don't work for me want. I drive my truck and easy. See me buy one next one. God bless me for buy one next one.
And the reason why, my father drives truck too, and I can't get it. He makes too much money.
My father told him have a business job as a plumber, a time side hustle, and him work at airport. And him always tell me say him not get them sitting there.
You can't, there's certain people not gonna get it. I think if you make over like 30 a year, 30 something thousand a year, you're not gonna get it or something like that.
Hey Shay.
Can you guys hear me?
But may I come down and give people a chance. Are you sure?
Alright.
May I come down too? Give somebody else a chance too.
Hey Shay.
Hey, what's up?
Good. I remember. I'm here for a quick one.
Can I
I
just talk for a quick second so I could come
Oh,
down?
hold on, Kina K. Where's the K?
Must say, people are getting food stamps for November. I work at the EBT office. Like, you guys are getting stamps. So, when people I say them now get stamps for November, it's just confusing because even at work we did a meeting and everybody
Where you work? Question. Where do you work?
in Florida.
Where? In which state?
In Florida.
Okay.
So I cover every single barrel in Florida.
Okay. So you're just talking maybe for the people them in Florida.
Yes, just for I know just for Florida though. I don't know about the rest of the states then, but for Florida, CBC is going out for November, December, and ongoing, and Medicaid and all of that. And the thing is, when I don't know who these people are, but they were saying that they not getting any food stamps. It's just the requirement for food stamps is different. And if you make more than $2,500 a month, and it's just you're the only one in the household, they're not gonna give you because they look at your income and say you can cover food. Remember, food stamps is just assistance. It's not something that you are required to get. They're just helping you out with food. And if you have like a child in the household that went through abuse and all of that, they give you money for them. So you can get food stamps, but you have to really show them like you really need it. If you pay all your bills and you have money left over, they're gonna tell you use that money buy your food. It sucks to say, but that's just how they look at it. That's just how the government in Florida. That's how Santas look at it. If when we put your income in and you have money left over after we calculate your expenses and your income, and there's money left over, they're gonna tell you use that money buy the food. And you can't be paying that. I just think the system is fucked up. The EBT system and the Medicaid system is fucked up.
Yeah,
and
that's true.
for the person who say you can't get, if they don't have no papers, them I got call I find you will go to the hospital. I don't think that's true because I have a friend and him did sick and him go to the hospital and him just find them just mailing him bill. So I don't know. Maybe they live in a different part of Florida, but in Fort Lauderdale, it's different.
Yeah, they want to be in your business. I saw it over here. They want to be in your business too. Yeah, the government like to be in your business for no much money.
Literally, because me I tell you, say, we can see everything. So if you lie upon your application, they're going to deny you without even asking you any questions because we've seen everything. And you were lying to us.
Okay, when you hear what the woman say, if you don't make over about 2,500,
that's for one person though. If it's you and your family and say you, the husband and wife and the penny them and the husband alone at work and film income alone at cover the expenses, the kids could get food stamps. So if you're a big able-bodied adult and you're making mad bread and you pay your bills, they're not giving it to you.
on a year,
they're not. Like the system, it fuck up for say, but it's just all them look on it. It's really just all them look on it. And if I could have write it, everybody would have get food stamp. Because even the big tough, if you're homeless, boy, the amount of homeless people they are fair that they're not really homeless. The system just fuck up. But that's just all I have to say.
Alright then, thanks.
Hey,
Yeah, mama.
you hearing me?
Yeah, me I hear you.
All right. I work in ICU. I work in the hospital. And I notice that a lot of things now that is happening, like a lot of things Medicaid is not covering again like what it used to. Because me and one of my PAs, physician assistant, was talking, and he said that a lot of things is cutting, right?
Yeah.
From Medicaid for those who are on Medicaid. Mind you, the hospitals in here in New York depends on Medicaid, right? Because that's how we, the staff, nurses,
Get
and
paid.
doctors get paid,
Okay.
right? Because a lot of people can't afford hospital bill or to
Yeah.
pay out of pocket or even have insurance, right? To pay. That's one. So Medicaid is cutting a lot of things, and it's like it's a frenzy in New York, especially in the hospital setting, right? Number two, if I should come to the hospital as a nurse or a healthcare worker, you should not give out any information to anyone regarding to anyone who they're looking for, because one, that is under the HIPAA, right? That is under the HIPAA. You're not supposed to give out, not even to a family member if it's not a healthcare proxy, to anyone. That's two, right? So I remember some time ago, let me just finish with this. I remember some time ago last year, a friend of mine did knee surgery, and she's a nurse. And when she called them, they said that she hasn't worked for like 8 months. And they told her that she works too much money to get anything from the government from assistance. And mind you, these are people that work and pay taxes,
Taxes,
right?
right?
And people that are working and paying taxes can't even get help. Can't even get help
That's true.
when they fall. Because when listen, anything can happen to anyone, right? Anything can happen to anyone and you fall. Even though you're currently working, but you're out of the job because you did a massive surgery or you get into an accident or you're unable to work,
Right.
right? The bills are still coming in. You still have things to take care. The system is not helping you because they claim when they run your social security, they run your background, they said, oh, you're a nurse, you're a doctor, you're a this. Oh, you should have money. It doesn't work like that.
Right.
It
But
does not work like
cut you
that.
a little bit, and just from my experience with working with the food stamps and Medicaid, if you're adult, say you're gonna do one surgery, like referring to what you say, and you still have your bills to pay and you are not getting paid, they give you food stamps and Medicaid for that month that you're out of a job. And next month now you have to come tell them, okay, so how you pay the bills for this month, if you get what I mean.
Yeah, but you know how she was able to survive through the union, right? The union give you a little,
Yes, the
like
union, it's your
70% of disability, not much, a little, can't even do nothing to help out situation, right? But I'm just saying, I've seen in the hospital, my dear, they said that they're disabled and they get the most housing, Shay, they got
Yeah.
the most food, they have Wi-Fi, they have phone, they have everything, and nothing is wrong with them. Nothing is wrong with them because they know how to rig the system. They
yeah.
know how to
Because
rig the
even at
system.
work, when they go the policy, you know, me I say, but later, who work here, me or you? If me not
Kay,
say something too correct,
Mama tell you, me left my job at the care place and at the union pay me.
Kay and Miss Keena, don't leave yet. I have a question for Miss Keena first.
Yeah.
Based on what they say, right? As physician, nurses, doctor, they take a separate oath. So whatever the government says pertaining to ICE and everything, they take a different oath to protect the patient, right? So they don't necessarily have to follow that,
No,
especially if the union backs them, right?
let let
Correct?
Right. Let me speak for the nurses, right? Because
Yeah.
I'm on the nursing team, right?
Yeah.
Let me speak for the nurses. You're not supposed to give out information because one of
Right.
my coworkers work with a different New York Presbyterian, and I came in looking for a Spanish guy. Say for let me say Gonzalez. The patient was on the bed, and when she realized that it was I, she's like, "No, we don't have any. I don't know anyone." The
Right.
patient was right there. You're not supposed to give out anything, whether they're looking for them or not. They don't have that right to walk up. I'm talking for New York. I'm not talking for Florida or any
Right.
state. But here in New York, you cannot give out patients information if they're there or not, unless it is authorized by the family member or the patient himself that, listen, I want my mom or I want my sister and the so
Yeah.
and so. But as long you're there as a nurse to advocate for the
Right.
patient, that is in nursing training when you're in nursing school, to
Yeah.
advocate for your patient and to
Oh, you have to
protect your
protect your
patient
patient. Yes.
and
Yes.
protect your patient, their safety and their rights. And
Right.
once you forfeit that as a nurse, as I'm speaking, you are going to be in big trouble with HIPAA
Exactly, with HIPAA and the board, and it's a whole
on
big
the
thing.
board.
Yes.
That's a license losing, sweetheart. I'm
Right.
telling
So
you.
when persons are saying that they're afraid to go to the hospital, I think it's because the government is driving fear into people. But
Exactly.
persons need to know that it doesn't go like that, no matter what state it is. Because I'm in
Right now, you know how
Massachusetts,
many
right?
undocumented I have right now in ICU?
Yeah. And there is nothing like, I'm telling you, that's the most protected place. Okay, I can say Florida is probably different because
Yeah.
the type of person who are there, right? And they probably see Santos as, okay, he's ahead of us no matter what. And, persons use that for their agenda. But
Who
Right
Santos?
because
now,
of HIPAA,
yeah, the
because of the
Santis.
hold that they take, because of the council, the board, everything, it's like that's your license. Everybody have a license to protect. So
Exactly.
persons are afraid to go just because of the government driving fear, but they don't have the knowledge.
Right.
Next thing came with the food stamp, right? I can attest. It's not because I don't
Shay, take me
remember.
down, please.
All right,
Correct
ma'am.
me if I'm wrong.
Thank you.
You had said something about able-bodied person and getting the food stamps and stuff like that. Um, I work, my husband work, and I have two kids, right?
Yeah.
And no matter what, I would never qualify for nothing. You
Because
see,
of the income. You see, if your
because of the
income and your
income,
expenses, say your income are $4,000 for the month and your rent are 2,500. Them are gonna say, so use the other money there and your light bill
you
about
know the
hundred
worst
dollar
part
and the
about
water
it?
50.
You know the
That's
worst part
crazy.
about it? It's very crazy, Shay, because you know the worst part about it? They calculate before tax. You don't get before
Yes, they
tax.
don't calculate the net
They
pay.
don't
It's
calculate.
always the
And
gross pay. So
you
if about
know
five
who got
hundred dollar come out of your taxes, we
mm-hmm.
don't care. We're
And
calculating your gross pay.
you know who gets the food stamp, and when me say a lot of money, because I know the person is persons who are not working. And when you see what they ask you to work, that is not livable expense. You look at it and they're telling you literally, basically, just work under $200 in order to get food stamp. What about the electric? What about this? It's like they're telling you to live off the government so we can help you. So persons who are independent and like go out and just need a little help, just a little help, them cannot get that help no matter what, because guess what? They're always over the threshold, always. So they can never get the help. You see, when you say persons call you and I tell you how to do their job, your job, I have clients, right? Because I work in the hospital. And you see the same hospital bill and everything that they hustle everybody else to get. You see the persons who come in and say they're homeless, who pay that bill? Nobody. And they cannot report it. Because these people know how to hustle the system. They know, like, when I sit and listen to them tell me how them get food stamp, me like, but hold on there. Me I eat that. And me I tell you, say, the people them when I work, I get it. So you see the people them when I work, they now get a penny,
So
not one
what
penny.
government, what them plan for changing the system in America that people that
Me no
pay
know.
tax Are you willing to help them also if them running a one little difficulty? Just have
No,
a
they not help
right
we.
now.
They, in our, they call it 401k. And but my work have a different name for it. You know, me
May
ask
I
them
come
because
down there,
whenever they
Shay?
come,
I'm in the
me
Alright.
sit.
comments.
All right, me sit and me talk to them. And me ask them say, my money me I save, right? If me want it, how me I go get it? You know what they tell me say? You have to in a financial hardship. You know what they consider financial hardship? You literally have to get kicked out of your house before they can give you the money.
Hold
Yeah.
on. Hold on. I have
Yeah.
a scenario for you guys.
Mhm. Yeah.
I was in New York, living in New York. I had a job, I thought I had insurance, right? I went to the ER just for a bug bite. Wasn't sure what bit me. I had a bug bite and my hand was swollen. The only thing the doctor did was look at my hand and he's like, it's a bug bite. I'll give you some hydrocortisone and you should be fine. I was like, okay, cool. Walked out. Probably a week after, I go check my mail.
One
I have
big
a
bill.
$1,600 bill for fucking hydrocortisone. For hydrocortisone, you gave me a $1,600 bill, and who's supposed to pay that?
You.
Oh, you might get in trouble for not paying your hospital. I
You
put
can't
me
get
in
in trouble
trouble.
for paying your hospital bill. It's a tactic they use because it's HIPAA. It's a HIPAA violation, and that's why they cannot report it to the credit bureau because
Got
they
you.
have to give them information in order for them to get your bill. And
Well,
you can always fight it. Trust me.
Okay.
I
Let me say,
know.
can I say something? I live in Florida. I live in Florida and I also work for the government. I'm a nurse. I work for the government as well.
Yeah.
And I work with a lot of
Be a
undocumented people because
nurse
I do
so
home
funny.
visits. And
Watch.
and let me tell you that the undocumented who are coming here and having babies, they are getting a bill. In Florida, they are sending them a bill, and
Yep.
what they're doing now, because I live in Palm Beach County, they used to give them insurance. They cut that out. They're not getting insurance anymore. So they used to get some form of Medicaid. They used to have things that they go around the system and give it to them. They cut that out. So we're seeing
Yeah.
a lot of that we're seeing right now with undocumented, and they
Yeah.
are billing them. They're not paying anymore. I don't know if it's because it's Florida, but they're not. It's federal, so it can't be Florida only because it's Medicaid is federal. So they are actually billing them. The doctors even to go to get prenatal care, because I work for the health department, and they used to come and get free, care at the health department where they go for their prenatal. They get all this stuff done. Not anymore. That's
So
zero. They have
Christian,
to what they're
I
doing. They are billing them if they're undocumented. They don't have insurance. They do fee for service now, so they have to pay something, but
Okay.
they cannot.
Christian.
It's they have different agency, different places like Found Care or Healthcare District, because even in the state the dollars are being cut within each states, because
Yeah.
my health department just had a massive layoff the other day. No nurse was affected, but other people like even IT
Where do
department was
you live,
affected. Big
Precious?
in Florida, Palm Beach.
Okay.
So
Oh,
they
your
are
place have
cutting.
layoff too, because I know someone that their place also have layoff with nurses.
And I work for the government. So people think that is not the government. And when it comes to Medicaid, they are doing a lot of cut. And people have to understand, when you have a lot of undocumented people and they're having all these babies, and I see it firsthand because I see they be having 5, 6 kids undocumented. They living off the system. They're getting food stamp. They're getting all this
Yeah,
stuff.
because they
The
can
government
get
is
the stuff.
things are
Yeah.
going to dry up. Things
Uh-huh.
are going to dry up. You cannot. There's no such thing as unlimited funds. There's no
Yeah.
such never. It was never ever anything of funds gonna dry up. Resources are gonna dry up. So that's
So
why
the
they're getting
people them in
so strict with
America,
it.
the ladies them there, they're abusing. No, not abuse. They
Yeah.
Yes,
advantage.
and
there
They
was this
and
abuse
the
the
next thing
system.
too,
there was this video that was going
2 years
viral.
ago, and you don't get nothing because I was out of work 2 years ago for 7 months because my daughter passed away and I had to
Oh,
go
my
to top get
condolences, mama.
disability. I was out of work for 7 months because I couldn't take it. I even left the country. I couldn't get nothing. I did not get I tried to apply for disability. I wasn't able to get nothing. They told me I have to be out of work for
Your
one
company have
year to
a
get disability.
union? You guys have a union, Precious?
We nurses have a union, but if you know about state jobs, there's
Yeah.
certain it's state
Certain
job is
benefits that you
very
guys don't get?
So
our
question.
benefits are good, but when it
Yeah.
comes to certain
Next
things,
question.
you cannot fight the state on it.
Okay,
In,
Might as
okay.
in,
well leave
in
it alone.
America, is it expensive to have baby?
Oh, yeah.
Yeah, it's expensive to
How
have
much?
baby.
Baby food
If
is
listen,
$60.
Shay, it's expensive to have baby. Depends on your
$60
insurance.
for one tin
So,
of baby food.
all right. No,
No,
no.
no,
Mm-mm.
like
I mean,
me
like
not
to go
mean
in the
so
hospital to
because
have baby.
Oh,
well, I'm not mean that way there because in a Belgium, my hospital bill come up to €8,000. So my insurance pay almost three quarter, and I was leave to pay like maybe like a 1,200 left to pay, and then pay off the whole light. So that's why me I ask, it expensive,
Yeah.
like how much thousands
It
that.
depends on your
It depends
insurance.
on your
Like,
insurance,
yeah,
but
it depends on your insurance.
I have a
Depends
good
on the
insurance because
medication
I
you're
have
taking.
no, and some
Everything's a
of them
depends.
you have to check your bill. So a lot of people when they go to the hospital and have baby, they need to ask for an itemized bill from their insurance. And why I demand it, when I went to have my son, right, in 2020, the doctor didn't come in because I wasn't an emergency anything. It was just the midwife and the nurses. The only thing I saw was the doctor's name on the board, and that's it. Never came in to say hi, nothing. They charged me for the doctor alone $16,000. That doctor never visit my room. I called my insurance and I told them they charge you for everything. Sure, they charge you for the room. Like when you get the itemized bill, you see they charge you for the room, they charge you for the medication, they
down
charge you
to
for
the
the equipment,
needle.
they charge you for the needles, they charge you for the bed, everything they charge you for.
My
They
cousin
charge for
Remember,
the
used to
I
cotton,
know
they
do
I
charge
have
for the
a
band-aid.
private insurance. Yeah, I have a private insurance, right? When I called them and I asked for my itemized bill and I saw the doctor, 16,000, I told them take it off because they don't need to pay that either. Because you know what? That doctor never even push him head through the room. So if you don't ask an itemized bill, especially if you have a private insurance, them whop your left, right, and center. You're
My
My
going without
last
a
my
bill
last
and you come
child
out
my
with a
last
bill.
child was born in 2010. My last child was born in 2010, and I have with insurance. I had all I paid was $100. The insurance paid the rest.
Yeah, after
my
me finish
cousin
tax
thinking to
them,
have a
it
baby
come
in
down to like
2020.
1,000 something.
Even even if my bill was even if my bill was $1 million, all I would pay is $100. That's the insurance I
Yeah.
have. That's the benefit of working for the state. Your insurance, because I had dengue in 2019. I was hospitalized for 4 days. My bill was $125,000. I didn't pay nothing. I paid zero.
Shell.
But my bill was hundred and
no,
twenty
come here,
five
I
thousand
wonder if this
dollars.
can real.
My
Yeah,
cousin
that's
came to
true.
the US to have a baby in 2020. Her bill before insurance took care of anything was $26,000.
Yeah.
They charged her for even the pee pad.
Yeah.
And the pee pad, me could have gone off Dollar Tree go buy one dog pee pad. $100 then charge for the pee pad. For the itemized
But
bill. $100?
Shay, the insurance doesn't pay all that. When the hospital, if the hospital don't pay the $25,000, the insurance probably just probably pay like 7,000. They don't pay all that. They mark it
Yeah.
up,
Because,
and then the
all
insurance
right,
just pay a fraction
Yeah.
of it.
what happened with insurance in Belgium? They don't pay for everything. It depends on certain medication. Like when I had my daughter, I did have to have one because me have hemorrhage, so me I bleed too much. So them give me like a balloon, a yellow thing to stop the bleeding. That is the only thing I have to pay for. They don't pay for it. So I have to pay for that. And certain medications you don't pay for in Belgium. While some you have to pay for, some you in every insurance in a Belgium. It's not everything them pay for.
Shay, honey, take me down here.
All right, darling. Yeah.
Hey,
So
Shay. Hi, guys.
in America, it's everything. Everything is by individual. It's not a one cut fit all. Every state is different. Then it breaks down into counties. Every county is different.
Christ, America
Yeah,
was
that's
slow.
true. Yes, hey, Shay, how are you? I
I'm
want
good,
it.
Mama.
Shay,
How are
how are you?
you? Yeah, I'm good.
I'm doing good. You know, say I'm a celebrity. Oh my gosh, I feel so overwhelmed and nervous to talk to you right now.
Thank
But
you.
may I try to chime in on this discussion here? I'm talking from both sides of the fence, you know, from living in the big city to now moving to rural Georgia, like what they call it country. And I
Okay.
can tell you this, when you in, like when I used to live in New York and the insurance and all of that stuff, even at that time, when you have to pay and certain resources, I believe the resources are distributed differently based on your area and your geographical location. Because with me living in the country right now, going to the hospital, once you just let them know your income is at a certain level, you don't pay for a thing. I know people that come from Jamaica and just come to where I'm at right now, just to have the babies. I mean, I'm not trying to let out anything. I work in law
Yeah.
enforcement now. I used to do nursing, but I'm now in law enforcement. I'm not classified or anything, so it's fine, whatever.
Oh,
But
okay.
when you have people come from different countries, just come here in this small country. I live in a county where there's only one hospital, so it's real tiny. Okay, so the resources here are great, and I think a lot of people is finding that out because our community here, we maybe only like 15,000 people is the population. One school district, one Walmart, one everything. Real small country, and then yes, there's a few Jamaicans here. But when it comes to the hospital, great service. You practically pay nothing, and even with my pay, and I have a good job with good benefits, I'd never pay a dollar for anything. But I knew when I used to live in West Palm Beach as well, and every time I go to the doctor, it's like you have to pay $35, $65 for everything. You have to pay this copay. And then I paid copay once when I went to do a colonoscopy and they sent me the $45 check back. So I think that those insurance companies, they target certain areas, and that's understandable. If I was living in Atlanta, because I'm in Georgia, but I'm in rural Georgia, but if I was in like Atlanta, which is a couple hours north of me, it would have been a different situation. It's
My
just
dad
that
live
where
in
you,
Georgia too.
yeah, it's just where you live, the resources is distributed differently. And the government
Oh.
strategically do it like that because guess what? Where you have more people, you're going to have more patients. So that's where more of the fundings are. And then where you have less people, that's where you're going to have, you still have your same amount of funding, but it's not run out. It's not depleted as it would in certain areas. And then in the country where I live, we might not have as much resources because guess what? Our hospitals are not overflowing with people. We maybe have like one or two births a week.
So
So
my
it's just
question
different.
is Georgia okay for immigrants or not?
So for me, where I live at, we don't have no issue with that. It's never on the news. We don't have those type of thing. We have Hispanic people here, and a few Haitians, and one and two Jamaicans like myself. But no, we don't have no issue. There's never a
I don't
concern
think
with
it's
that
that
at
bad
all.
in Georgia.
We have to go to another state for immigration proceedings because since moving here, I had to, take care of a family member and, assist them through petition, and I couldn't do it. I thought I had to go to Atlanta. No, because of where I live, I have to go to another state because that other state is who is in my jurisdiction because it's so
Oh.
small and we don't have an immigration population where immigration is a hot topic.
Okay,
And
okay, understand.
I love it. It's
Yeah,
in the
I
middle of
understand.
nowhere. It's like farms and cornfields, but people are
That's
living and thriving here.
okay, good.
But no, we don't have no issue. We don't have none of that stuff. It's never on the news. They don't come through here. They don't. There's just no need.
Yeah, because my daddy always tell me Georgia is like country. Not really no.
It's yeah. It depends on where you have North Georgia, South Georgia. Yeah, it is. But you have like Savannah, Augusta, and Atlanta. And Atlanta is like when I tell people Georgia, they just automatically think Atlanta. But yeah, we have over 100 counties, and some of them
Oh,
like 100 people is a population, and then like my county, it's not even 20,000. But hey, we have everything we need, and we don't have those issues with the medical and no. As a matter of fact, I had surgery. My daughter had surgery, and We felt like princess, the best treatment, never had a bill. There's so they find the resources to assist you if you need it because it's there, it's available.
Okay.
Unlike when you go to the big cities, it's so hard to find the resources, and then you have this long wait to see a specialist. Here, you call for a specialist, they're saying, oh, you can come in today, and they're still good doctors. They are good doctors. Yep. So it's just where you
That's
go. It's just
nice,
it's just the
no.
city. It's just where you live.
I see someone post, we in Florida don't have immigration issues. I want to know where in Florida personally because there's immigration issues in Florida.
That's what I'm saying,
Me
because I live in
always
Florida.
hear that too.
Maybe Middle Georgia. Middle Georgia is kind of
No,
country,
no.
like where
Someone
we
said in
live.
Florida we don't have
Yeah,
immigration
but
issues.
in
Yes,
a
we
Florida
do.
always have immigration problem because me
Florida is
always hear people
oh
say
Mm-hmm.
that.
We
People
because
have
where I
always
immigration
say
live,
problem in
that.
Florida.
where I live in
That's
Shay,
where
Florida.
when
it
you go to the
actually
hospital,
starts.
I went to the ER recently, and they asked me about my immigration status.
See,
Oh
I
wow,
told you, you
really?
cannot
And I
go to
went to
the
the hospital
hospital.
recently.
They will.
I've been in
It
America
depends
40
on what
something
type of
years.
nurses,
It
too.
just depends. I mean, everywhere I go, people always like, "Where are you from? Oh my gosh, I love how you sound. Oh, I just want you to read me a book. Just talk. I love. Oh, where are you from? When we used to live in New York and Florida, shoot, the white people them understand you because guess what? Them used to it. Yeah,
Mm-hmm.
everybody know the
It's
food.
true.
Everybody know everything. Yes, I want me
It's
there.
true.
I yes, I me feel like me a foreigner. Yes, I me feel like me a tourist.
Mm.
They're like,
I
oh
and
my
I,
gosh,
I
you
used to
sound
live in New
so
York
nice.
too, so I know that I lived in New
I'm in
York. I lived in
Florida
Georgia, in
County,
DeKalb
Nelson.
County for a while. I know I'm in
Wait,
Florida.
hold on. So, when this person named Sharon, you live in Broward County, I live in Broward County, and where I live, not too far when Trump just got in,
Mm-hmm.
the Broward meat near where I live, I used to raid that place. I shut it down and
Wow.
raid that place. In the Home Depot by the Publix, there used to be a whole bunch of Haitians. There's no more Haitians out there
Wow.
because they can't go out there because ICE don't. People will call ICE on them.
Oh wow.
Like literally, you cannot walk into Publix, Walmart. ICE will go in there, shut it down, and raid that place. So I don't know when on
I don't know where in
441.
Florida she live, because I in Palm Beach County. Even to today, I did home visit in a city called Belglade, and Belglade is very rural.